Today, we will be discussing the different methods of birth control and helping you feel more informed and confident on what the right one for you is, if you want one at all. When it comes to family planning, managing symptoms of out-of-control periods, and even other things like PCOS, there are various options available, each with its own benefits and considerations, and not every option is good for every problem.
It's Doctora Victoria and George.
Today, we are joined by George's twin, Georgiana. Georgiana has just delivered a baby boy, baby indoor, and is hoping to find the right kind of birth control for optimal family planning before having another baby. Deciding on the best birth control method for you can be a challenge, considering the wide range of choices available. The most suitable method is one that you'll be able to use consistently and doesn't cause bothersome side effects. Some factors to consider include efficacy, convenience, duration of use, impact on your monthly period, potential side effects, affordability, privacy concerns, protection against sexually transmitted diseases, and how quickly your fertility returns if you stop using it. It's also important to think about whether you're comfortable with daily pill reminders, involving your partner or partners in the decision, and your future pregnancy plans. Remember, no birth control method is perfect, so it's about finding the balance between advantages and disadvantages for what works best for you. Let's start by discussing the birth control implant. It's also known by its brand name, Nexplanon. The implant is a small rod, kind of like a long tic-tac, a little more bendy and soft. It contains the hormone progestin that is inserted under the skin of the upper inner arm by a healthcare provider. It provides at least 3 years of protection against pregnancy. Insertion and removal can be done in an office or clinic setting. The implant is one of the most effective birth control methods available. However, irregular bleeding is a common side effect. It's important to note that fertility in most instances returns rapidly after the rod is removed. Another hormonal method of birth control is the intrauterine device, an IUD with progesterone. There are several types available, such as Mirena, Liletta, Kyleena, and Skyla. These IUDs contain the hormone levonorgestrel and can be left in place for different durations depending on the type. Levonorgestrel IUDs are highly effective in preventing pregnancy. While irregular bleeding is common initially after placement, it tends to diminish over time. Mirena and Liletta users often experience little or no bleeding, while those using Kyleena or Skyla are more likely to continue having monthly periods. Moving on, we still have injectable birth control. Currently, the only injectable contraceptive available in the United States is depot medroxyprogesterone acetate, DMPA, commonly known as the Depo-Provera. This is given as an injection once every 3 months. It prevents ovulation and thickens the cervical mucus, making it difficult for sperm to enter the cervix. It's highly effective with a failure rate of less than 1% when administered on time. However, irregular or prolonged bleeding and spotting are common side effects, especially during the first few months of use. Some individuals may also experience weight gain. And can I just say, it works when it's used, but getting a shot every 3 months can be cumbersome. And I worked at a local crisis pregnancy center in my hometown, and many of our unexpected pregnancies, they came from inappropriate use of this medication. Folks just never went back for their next shot, and oh, well, we got a baby now. So next, let's talk about birth control pills, also known as the pill. Most oral contraceptives contain a combination of estrogen and progesterone hormones, but there are some progestin-only ones. They work by preventing ovulation, thickening cervical mucus, and thinning the lining of the uterus. The pill can make menstrual bleeding more regular, reduce menstrual pain and cramps, and offer other benefits such as a decreased risk of ovarian and endometrial cancer. However, to maximize efficacy, it's important to take the pill every day at the same time. Missed pills can and do increase the risk of pregnancy, and some people may experience side effects like nausea, breast tenderness, or mood changes, not to mention major mood swings if there are missed doses. If not taken regularly, hormone levels are going up and down drastically, and that is not fun, not for the patient or anyone else around them. The natural fertility awareness-based method, also known as the fertility awareness method or the symptothermal method, involves tracking and interpreting different signs and symptoms throughout your menstrual cycle to determine when you're fertile and when you're not. This method requires monitoring basal body temperature, cervical mucus changes, and the position of the cervix. By understanding your body's fertility cues, you can identify the days when you're most likely to conceive and avoid unprotected sex during those times. The natural fertility awareness-based method can be effective when followed correctly, but it requires a significant amount of dedication, consistency, and education. It's crucial to receive proper training from a healthcare professional or a fertility awareness educator to understand the method's intricacies and improve accuracy. Keep in mind that this method does not protect against sexually transmitted infections. None of these contraceptives do that. So condoms are still important. If you're at risk of STIs or not in a mutually monogamous relationship, it's essential to consider using barrier methods like condoms in addition to any contraceptive. And if you're having multiple partners a year, you should be asking your doctor about PrEP. This is a prophylactic treatment to prevent HIV. You sleep with someone, you're sleeping with everyone they've ever slept with, and all those diseases that they're exposed to. And if you're having multiple partners, I'm just saying you do not want to be getting HIV because that will change your life. The copper intrauterine device, commonly known as the copper IUD, is a non-hormonal form of birth control. In fact, the only non-hormonal option besides the natural fertility awareness method. It's a small T-shaped device that is inserted into the uterus by a healthcare professional. The copper IUD works by releasing copper ions that create an inhospitable environment for sperm, preventing fertilization. It acts like a spermicide, and it can provide long-term contraception for up to 10 years, depending on the specific brand, and this is the longest out of all of the options. One of the significant advantages of the copper IUD is that it does not involve the use of hormones. This means it does not interfere with your natural menstrual cycle or cause hormonal side effects. Additionally, once the copper IUD is removed, your fertility returns quickly. For women who smoke, they are at a higher risk of developing blood clots, and hormonal contraceptives, especially with estrogen, also increase that risk. So the copper IUD is a good option for them if they want some form of birth control or contraception. However, it's important to note that some individuals may experience heavier or more prolonged periods and increased cramping during menstruation with the copper IUD. This side effect varies from person to person. If you already experience heavy periods or severe menstrual cramps, it is worth discussing this with your healthcare provider before choosing the copper IUD. I also want to mention, no contraception is 100%. Some are very good. That next one on, it is statistically better than abstinence on preventing pregnancy. I'm not sure how that works, but that's the data we have. But if you're not prepared to get pregnant, perhaps you need to reevaluate if having sex is right for you to begin with. There's also intravaginal contraception. The Nuva ring looks like kind of a plastic hair elastic that you tuck up inside the vagina. You leave it in for 3 weeks and you take it out, have a period, and restart. Likewise, there's a patch. It sticks on your skin for 3 weeks, you take it off, have a period, and you place a new patch for another 3 weeks, and so on. I find that if patients have issues with the patch, it's a reaction to the glue on the patch. But I find these are nice for folks who have a hard time remembering to take contraceptives daily, but are not keen on years worth of contraception in those IUDs. The patch I find is really good for my teenagers that have a hard time taking a pill all the time. All of these methods have their unique advantages and considerations, so it's essential to consult with a healthcare professional to determine which one aligns best with your needs and preferences. So that kind of wraps up our discussion on birth control methods for today. Georgiana and I hope that this was helpful for you in guiding you towards the right choice. Remember, it's always important to consult with your healthcare professional for personalized advice based on your individual circumstances. If you've got other questions or want us to cover other topics, leave us a comment below. Don't forget to like and subscribe and for more informative content. Thank you for joining us today, our healthcare team, and we hope we'll see you next time. Bye-bye.